Yes, ma'am. And I am pleased to be joined by the Chair of the Health, Hospitals, and Social Services Committee, Council Lady Edith Taylor Langster, to my right. We are also joined by Renee Pratt of the Social Services Department. And Renee, if you would please introduce who you have with us and begin your budget presentation for us.
Okay, thank you, Chairman. I have with me Pam McEwen. She's our Chief Financial Officer, and in the back we have Metro Social Service staff as well. Thank you so much. We can absorb the 2% budget cut, although it does have a vacancy, a vacant position. It does not result in a layoff, so we can absorb that cut. Also, I'd like to mention that Metro Social Services released our annual 2011 Community Needs Assessment. As you well know, that our planning and coordination staff produced this report to provide data and descriptive information about existing and projected unmet social services needs in the community. I think about a couple of months ago, you received a copy of our community needs evaluation along with some reports and some maps and some information as it related to your council districts. So I hope it was helpful. If you would like additional information, we can provide that for you as well. Thank you. And are there questions?
Thank you very much. Council Lady Berry, you are recognized.
Thank you, Chair. Thank you, Lady Langster. And thank you for coming down here. I just wanted to thank you, first of all, for all of the hard work that your agency does. And I noticed in the cuts that there are two things that I think are fairly glaring, and that's the $29,000 where you're no longer going to be able to provide meals for elderly and handicapped in our community. About 7,900 meals, I think, is the number. And the other one is the assistance to help $10,000 for the bus passes to help folks actually stay employed and be employed and get jobs. Those seem to me in a down economic time to be something that's pretty significant. And, we're hearing from lots of people who are definitely in a financial straits. So, this is, I think that this is something that, the chair I know is not there for a second, but it's something I would like to add back to the wish list, and something that I hope my fellow council members would also be supportive of. And if there's anything you want to add to that, please do.
Thank you so much. Yes, nutrition is very important, and cutting that budget really does hurt many of our clients. It does result in a $29,000 cut, but over the past 2 years, we have underspent in that particular line item. So we felt this year we could absorb that cut, but it does also impact the elderly and the disabled, so we appreciate you requesting that as well. And our bus tickets, that reduction is $10,000. We have underspent as well in that particular line item. We are better stewards of that money and administering those bus passes, so we can absorb that cut, but again, it will hurt us as well in the community. Thank you.
Thank you, Council Lady. I do have that noted, and also appreciate you asking for the 30 seconds that I was away from the chair. Councilman Tigard, you're recognized.
Thank you, Ms. Pratt. What is the overlap between the clientele that you serve and the Metro Action Commission? Is there a lot of overlap between these individuals?
There is overlap. We pretty much serve the same customer base. The difference between us and Metro Action is they give out monetary assistance for renting utilities and things like that. We don't provide any monetary assistance, but we do provide case management services, and our social workers look for that assistance in the community to help people that come directly to us. The overlap is separated, but again, we do still have the same customer base.
But you do give out bus tickets to those clientele that qualify, so that would be similar type of assistance.
Similar type of assistance, but I don't believe they administer bus pass.
Have there ever been any discussions about combining the two agencies into one?
Quite a bit of discussion in the past.
Where do we stand on that?
I don't think at this time it's being discussed currently. I don't believe that anyone has brought up merging of the two agencies.
Would there be economies of scale and certainly convenience to the customers from not having to go to two different venues or locales?
Well, We are located with Metro Action right across the hall from them in one building now. So we do provide two totally different services, but again, we do have the same customer base. So it would save the customer time if we are combined, but I do agree that we still provide different services than Metro Action.
What would be a process to explore any economies between merging the two agencies? Could you provide us a synopsis or a recap of, just like I asked Mr. Cobb previously, sort of it doesn't have to be single-spaced as the chair wished, but sort of the pros and cons of what you see for that, and I will also ask the administration and Metro Action Commission to provide likewise.
And we'll provide the history of that question because it's been asked many, many times in the past.
Okay, thank you.
History on it. Thank you.
Councilman Hunt, you are recognized.
Thank you, Mr. Chairman. I just want to make a comment on what my colleague Charlie is saying. Having been a director down at MAC and assistant director of social services, I think the only thing that's similar in those two agencies is they provide social services of a different type. I can always say that the Metro Action Commission has a much more intense program than social services have. Social services provide a lot of good services for senior citizens and other people in need of this city. But as far as providing services on an emergency basis, as an intense emergency basis, social services don't do that. And I just think that the two agencies have a totally different mission, although they provide social services for some of the same people. Thank you.
Thank you, Councilman. Council Lady Gilmore, you're recognized. You had fallen off my queue, and I didn't want to forget you.
Thank you, Mr. Chair. I so appreciate you. I just want to echo Council Member Berry's points, and I also wanted to include that in the wish list. I read the assessment, and I was also there for the release when you did it at the Goodwill. And the 19th district is shocking to people, but it's one of the highest poverty areas. And I just think we got to take care of our elderly and homeless. So I would like to have that in the budget as well. And I think she stated it very eloquently. During this time, we need not to cut back from things like this.
Thank you.
So you have my support.
Thank you.
So noted, Council Lady. Councilman Bedney, you're recognized.
Hi. I guess I wanted to know, you guys are the people that will advise people on how to apply for TennCare and other programs out there?
Yes, many of our social workers are well versed in how to apply for SSI, TennCare, Medicare, whatever the customer needs, we try to provide that assistance.
I guess I'm trying to find out because I'm told that we don't take advantage of TennCare as much as we should. I mean, the population that is in need. And we heard from, for example, Caldwell the other day that it was hard for people to find out that they could qualify for the tax freeze. Is there any way to track how you engage with each client and how to ensure that they are taking advantage of all these programs? Because when they are getting these monies, then it benefits our budget because, you know, somebody won't be going to a hospital without having insurance. So is there something you're tracking?
We don't currently track that. We can start tracking that information if you're interested in that. When a customer comes to us, we try to look at all areas of need at that time. And if they have hospital bills, if they have other expenses, we do tap those other resources, TennCare and those types of resources that could possibly help them. So some of our social workers are well versed in that, but we can start tracking that information if you'd like.
I think it will be important to make sure that we make sure that the Nashvillians take advantage of as many programs as possible. So thank you.
Thank you.
Councilman Stein, you're recognized.
Thank you, Mr. Chair. Have been going through the needs assessment work, and it's important and really interesting work for this community. I'm curious as if there are budget implications out of that needs assessment. Obviously, there are great amounts of money needed to those needs, but I wonder if there are specific things that impact this budget, and or very briefly, since we're focusing on this budget, if you all see some specific things that might come out for the next few years.
Yes, I think one of the areas that we recognizes with housing and related assistance, and also people needing assistance with rent and utilities. We have best practice information in the community needs evaluation that can address those specific issues. We have not currently tied it to our budget, but it does make a definite impact here in the Davidson County area as it relates to services that are currently needed. Probably over the next 2 to 3 years, we'll expand that and look at budgets and hopefully make recommendations as it impacts our constituents, and hopefully we'll address some of those issues that are in the community needs evaluation.
Thank you.
Thank you.
Seeing no other members in my queue, Ms. Pratt, we appreciate you being here. Thank you so much for all you do.
Thank you.